Welcome to the Burnaid channel. Thank you for joining us. Today, we'll be discussing a nursing care plan for ineffective airway clearance. This condition occurs when a patient is unable to clear secretions or obstructions from the respiratory tract effectively. In this presentation, we'll cover assessment, interventions, desired outcomes, and evaluation to help manage and improve airway clearance. Understanding ineffective airway clearance. One definition: ineffective airway clearance refers to the inability to maintain a clear airway, leading to compromised ventilation. Two causes. Common causes include respiratory infections, chronic obstructive pulmonary disease, COPD, and asthma. 3 signs and symptoms: patients may exhibit difficulty breathing, coughing, abnormal lung sounds, and decreased oxygen saturation. For importance, effective airway clearance is crucial for adequate oxygenation and preventing respiratory complications. Nursing assessment for ineffective airway clearance. 1. Respiratory rate. Monitor the patient's respiratory rate and rhythm for signs of distress. 2. Lung sounds. Auscultate the lungs for abnormal sounds such as crackles, wheezes, or diminished breath sounds. 3. Oxygen saturation. Use pulse oximetry to assess the patient's oxygen levels. 4. Sputum production. Evaluate the color, consistency, and amount of sputum produced by the patient. Nursing diagnosis for ineffective airway clearance. 1. Nursing diagnosis. Ineffective airway clearance related to specific cause as evidenced by abnormal lung sounds, coughing, and difficulty breathing. 2. Goal. The patient will demonstrate effective airway clearance, as evidenced by clear lung sounds and normal respiratory patterns. 3. Expected outcomes. The patient will maintain an oxygen saturation level of 95% or higher, exhibit effective coughing, and have clear lung sounds. Desired outcomes for airway clearance. 1. Improved oxygenation. The patient will maintain oxygen saturation levels within normal ranges. 2. Effective cough. The patient will be able to cough effectively to clear secretions. 3. Normal breathing. The patient will exhibit normal respiratory patterns without signs of distress. 4. Clear lung sounds. The patient will have clear lung sounds upon auscultation, indicating effective airway clearance. Nursing interventions for ineffective airway clearance. 1. Positioning. Elevate the head of the bed to 45 degrees to facilitate easier breathing and promote lung expansion. 2. Deep breathing exercises. Encourage the patient to perform deep breathing exercises and use incentive spirometry to enhance lung function. 3. Suctioning. Perform suctioning as needed to remove secretions from the airway. 4. Hydration. Ensure adequate hydration to thin secretions, making them easier to clear. Nursing interventions for ineffective airway clearance, Part 2. 1. Chest physiotherapy. Implement chest physiotherapy techniques, such as percussion and postural drainage, to mobilize secretions. 2. Administer medications. Provide prescribed bronchodilators or mucolytic agents to improve airway patency. 3. Monitor respiratory status. Continuously monitor the patient's respiratory status, including respiratory rate, effort, and oxygen saturation. 4. Education. Teach the patient and family about airway clearance techniques and the importance of adherence to the treatment plan. Evaluation of nursing care. 1. Respiratory assessment. Reassess the patient's lung sounds, oxygen saturation, and respiratory rate to evaluate the effectiveness of interventions. 2. Outcome achievement. Determine whether the patient has met the desired outcomes, including effective coughing and improved oxygenation. 3. Patient feedback. Gather feedback from the patient on the effectiveness of airway clearance techniques. 4. Care plan adjustment. Modify the care plan as needed based on the patient's progress and response to interventions. Daily requirements for airway clearance. 1. Breathing exercises. Encourage the patient to perform daily deep breathing exercises to maintain lung function. 2. Hydration. Ensure the patient stays adequately hydrated to keep secretions thin and easier to clear. 3. Medication adherence. Instruct the patient to take prescribed medications as directed to support airway clearance. 4. Regular monitoring. Advise regular monitoring of respiratory status, especially during illness or exacerbation of symptoms. Tests and evaluations for airway clearance. 1. Chest X-ray. Obtain a chest X-ray to assess the lungs for any obstructions, infections, or other abnormalities. 2. Pulmonary function tests. PFTs. Conduct PFTs to evaluate lung capacity and function. 3. Sputum culture. If infection is suspected, obtain a sputum sample for culture and sensitivity testing. 4. Arterial blood gases. ABGs. Measure ABGs to assess oxygenation and ventilation status. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burnaid app for free from the Play Store or App Store for answers to more than 3,000 questions.